But it certainly shows that the decision about withdrawing treatment is just as much a decision that you can get wrong and you can be dramatically shortening someone's life as the decision that we're talking about.
And let me just add that I have interviewed hundreds of people and heard stories of thousands more who wanted the option to be able to end their lives, and because they had to deal with a system in which what they were doing was illegal, they felt they had to do it while they still had enough vitality and enough self-control to take the lethal medications that they had been able to obtain, and they over and over and over and over again die months or sometimes years earlier than they would otherwise be going to die because they're afraid that they will lose that capacity. And my own mother said she could have lived longer if she hadn't been afraid that those intestinal tumors would make it impossible for her to ingest the medication.
Let's let Ilora Finlay respond.
But Andrew, we're talking about physician-assisted suicide in which the patient has to take the medication, or the lethal drugs, I would prefer to call them, and that's what they have to do. So that's not consistent. What you're arguing for is euthanasia. And that's not what we're debating tonight.
Make the distinction for us.
Well, in physician-assisted suicide, the doctor prescribes lethal drugs, the patient has to self-administer.
And that's the law in Oregon.
And that's the law in Oregon, and they will say in Oregon, well, if you can't do that, then that's too bad. What you're arguing for is that the doctor injects you with lethal drugs because if you can't take them yourself.
I'm arguing no such thing. It's not a question of whether the doctor is injecting you. It's a question of whether you'll get into a hospital within which you will not be able to exercise your own volition anymore because the hospice system can be so controlling and you are so tightly monitored that you lose the capacity to take those drugs.
Well, why would you have to kill yourself because you've got a failure with your healthcare system? I would suggest you need to rectify your healthcare system so people can make choices and control.
Excuse me, but the only way to rectify that aspect of the healthcare system would be to give people the capacity to take those drugs under supervision of the healthcare system, which is precisely what you are opposing.
No.